Hi, this is Aaron K. Tangano from the county of Santa Clara, where I have been a resident for the last 35 years. I am addressing this message to the people of Santa Clara County and with particular attention to the county supervisor of our district, Mr. Ken Yeager. The subject of my presentation is about the broken healthcare and judicial system in the county of Santa Clara. First, I should thank for all the good work Mr. Ken Yeager has done for the county. However, there are still some pitfalls that need to be addressed urgently before it hurts more people. That issue is the treatment of the patients in the emergency room of Santa Clara Valley Medical Hospital. The nurses in the ER were not trained well to perform EKG test, nor did they realize importance of following proper protocol when I came to the hospital ER on January 15, 2009 in the late afternoon with the symptoms of chest pain and shortness of breath. For such patients, to avoid permanent damage to the heart and to bring them to normal breathing, oxygen must be administered as soon as possible. As case in point, I want to discuss my own bad experience. However, before addressing to you, I already presented my case to the customer service of hospital, then escalate to the risk management, County of Santa Clara. The liability claims advisor, Mr. David Schroeder, vehemently rejected my complaint. Then I knocked at the doors of small claims court and thought fair justice would be served. But the Commissioner Lisa Steingart on June 25, 2009, the day of hearing, mentioned she does not have an evidence like physician present with me to testify, and secondly, she does not have an MD, so she is incapable of making proper decision. Also, it looked quite ludicrous when she asked the defendant if the hospital had done any malpractice in treating me in the emergency room. Naturally, his answer was no, because I thought hardly any criminal in the history of the mankind would admit to his own crime. So the only way judge can get to the facts is through the cross-examination. Therefore, she rushed her judgment against me, and I thought I have got a very unfair verdict because of my following argument. I strongly believe the judge did not have to look for any more evidence than I presented to her. The facts speak for itself. I told her that when I was in the Valley Medical Hospital, I had chest pain and shortness of breath. With passage of time, my condition was getting only worse. Now I went to the Kaiser Hospital. They followed the protocol and immediately administered me oxygen, which improved my symptoms considerably. Probably, if I would not have taken my initiative quick enough, I could have either faced an irreversible heart damage or could have passed out. The reason I am saying Commissioner passed a wrong judgment is because facts speak for itself. Kaiser doctors knew this type of patient needs immediate oxygen, and myself as a patient, I felt my life is being restored. I don't think she needed an MD to understand shortness of breath can be restored by external oxygen, but a good common sense judgment which she liked considerably. It's like saying if one was thirsty and is ready to pass out because of severe dehydration, then in that case anybody with a common sense would say that person would be okay if the water is supplied to him in a timely manner. A judge does not need an opinion of a doctor to understand if a thirsty person needs the water to quench his thirst. Similarly, when a Kaiser doctors administered oxygen and I felt relieved, it speaks volumes for itself. That was an important part of the protocol. To further highlight her incompetence in making the right decision, I did research about her past judgments. I found her overall rating is D-. In view of these facts, keeping these facts in view, I think because of the incompetence of the Commissioner Lisa Steingart, she should be forced to resign, and the nurses in ER room should be well trained. People in Santa Clara County deserve fairness and better treatment. Secondly, I should be compensated for my life being compromised because of hospital malpractice. During my previous experience, when I lost wrongfully one case, I escalated to the Judicial Review Board. Despite the merits of my case, they passed the judgment in favor of the judge, and I was left with injustice. It seemed to me one judge would favor another judge. Since I am very well frustrated with the health and judicial system, I am putting my case in front of the public forum, YouTube, Facebook, MySpace, and more. Details of this case that as were presented to the customer service at Valley Medical, Risk Management at Santa Clara County, and Small Claims Court are mentioned in a text form sent to the County Supervisor, Mr. Jan Yeager, for the follow-up. I am looking forward to hear from the County of Santa Clara about their plan of action to resolve these issues I raised. Thank you for your time. God bless America. Bye-bye.